If you walked up to 100 people on the street and asked if they had a loved one that was struggling with substance use issues, where would they send them? Most people would say one of three things. They would say they should go to a 12-step NA or AA meeting. That would be one option. They could go to detox. And the third option most people think of is inpatient rehab, where you go away for a month. And what's not widely known, unfortunately, is the success rate of those interventions for most patients. And this isn't to say it's for all institutions, but unfortunately, on a national level, when you take all of the numbers together, the average success rate of AA in the literature is only 8%. The average success rate for detox is less than 10%. And the average success rate for rehab is actually 13%. And so people are going into an inpatient stay or treatment expecting to come out successful and cured. And the reality is that only 13% of those folks do well long term. There was a very recent study that came out that confirmed those numbers. It was conducted by a group called Vista Research out of Florida. They published a study where they had connected with 6,200 people who had just gone to inpatient rehab. And they asked them questions in a survey regarding how quickly after leaving rehab did they have any struggles. And unfortunately, within a week, nearly a third, 30% of people on average, had returned to use. Within 30 days, 55% of people had returned to use. And within 6 months, 86% of people had returned to use. And so that basically completely correlates with the data in the literature, because that, if you look at that graphic, it continues to climb from above that. So we know at the very least that study confirmed that only 14% of people were doing well after 6 months. The other thing that was really fascinating is they also looked at how long the patient was in treatment. So it didn't matter if the patient was in treatment for 30 days or if the patient was in treatment for 90 days or more. The speed with which they returned to use at the 1 week mark was the same. So in other words, on average, roughly 30% of patients returned to use within a week, whether they were in treatment for a month or they were in treatment for 3 months. What this tells me is that treatment that unfortunately isn't effective for most, for that same cohort of people, it does not become more effective if you do it longer. What it does become is more expensive. And that's why we need to really think about alternative ways to address this problem that will help people be much more successful long term.